When thinking about the contributions of the clinical pharmacists to practice, pharmacists bring the expertise about medication use. This goes all the way across all areas of medication use, from that initial decision on what drugs do we carry in a pharmacy, what drugs are we going to prescribe for a patient, how do we prepare and dispense those drugs accurately and safely, making sure the drugs get to the patient, and then finally monitoring the patient to assure that the outcomes that we want to happen with the drugs are happening, both positive outcomes and that we're avoiding negative outcomes of medication use. So when we look at the role of the pharmacist in clinical pharmacy practice, the pharmacist has responsibility for the care of that patient at every decision point in the medication use process. They need to assure we have the right medications available. They need to work with the other members of the healthcare team in assessing the patient to determine what is the best course of therapy for that patient. And when it involves medication, the pharmacist is responsible to provide input on the decision for the medications that are ordered. The pharmacist is responsible to assure that once a product is decided for a patient, it is prepared and made available to that patient safely, effectively, and to assure that it is appropriately delivered to the patient and there's care that it is a secure environment. Pharmacists are usually not involved in the administration of medications. However, we are getting more involved in areas such as vaccination administration. So there are areas, even in that piece of the medication use process, that the pharmacists have a role. And then finally, they need to work with care providers and look at laboratory results, look at what is going on with the patient to assure that the right decisions have been made and we are achieving what we need to achieve for patient outcomes. There are so many roles that a pharmacist can play within a hospital. For starters, there's the traditional role where a pharmacist is responsible for assuring that they're receiving the appropriate orders for a patient. It's prepared appropriately, whether that is a packaging, whether that's making a sterile product, and then it's dispensed to the nursing unit where a patient resides, and we get the dose to the patient when they need the drug. But we take that a step further because we're responsible for the drug information and making sure that the people who are administering the drug, the people who are making the decisions for these drugs, have the information and the knowledge to make those same decisions. We take that a step further. The pharmacist has a role on the floor within the team. So when we're looking at expanding pharmacy services and moving forward within a hospital pharmacy, the pharmacists should be placing themselves with the medication team, with the medical team, with the nurses, with other healthcare providers, where decisions are being made about a patient, as we're determining what is going on with the patient, what changes are going on, what therapy needs to be done, and if that therapy involves medication, the pharmacy needs to have input into those decisions. So we have a role of a clinical pharmacist who we will say places themselves on the floor where the decisions are being made, and they may specialize in a given area. For example, oncology, surgical care, an intensive care patient or area, or even the emergency room. There's also other positions. There's managerial positions that pharmacists play. There's roles within information systems and technology that pharmacists need to take a leadership role. And then within the hospital itself, pharmacists have a major role in medication safety and in patient safety, where they can step forward and be leaders in the care of the patient. So when we look at moving from, I will say, more of a traditional role of a pharmacist in a central pharmacy area, they can expand what they do, which means they expand their input in the care of the patient throughout the hospital. In looking at suggestions or a plan for expanding or changing pharmacy services, I would start with the vision and think big. What should pharmacy services look like? What should we be doing within the hospital for our patients? What is the role of the pharmacist? How do we work with others on the healthcare team? How do we work with our patients? And then look and see where you're at. What are we doing? What would we like to be doing? And that's going to be a gap. But identify what are some of those important steps that we need to do in order to start to expand our services. You're not going to find that you're able to complete each of these things all at once. So identify what is most important as you take those steps to improve the care and the services that you provide. So you have a grand plan and look at the little steps that go there. So you may start by looking at expansion of pharmacist services from a central area to the floors. Identify the high-risk patients. Identify where most of the medication problems are. Identify where you have medication errors. What is the areas that pharmacists can provide the most benefit from a patient care standpoint, from a patient safety standpoint, from a quality standpoint, and figure out how you would need to get there. Now, with this grand plan and the vision, people need to be on board. It has to include not only the director of a pharmacy, the staff pharmacists need to be involved. If you have technicians working in your pharmacy, they need to understand that their role will change as you change pharmacy services. If you're working with nursing staff in a different manner, if you're working with the physicians in a different manner, if you're working with physical therapists or dietitians in a different manner, they need to support the changes that are being made. And in addition, there's always administration. So as you're looking at expanding services, they need to understand the value that pharmacists bring to patient care. So when you have this large vision, our goal is to expand the role of the pharmacist, but the actual outcome of the goal is to improve patient care and improve the quality of the care. So they need to understand the big concept, and they need to support the little steps. And then as you're looking at the little steps, that's where the plan comes in. Will you change what an individual pharmacist is doing? Do you need additional people to do your services? Are your current staff trained appropriately? So you'll have to look at how do we get to that next step to make sure we have qualified people, that we have adequate people, that our systems are in place in order that we can start to expand our services. So you look at a big map and then break it down into pieces that are manageable. And as you do this, your services will start to grow and you'll be able to continue to provide care for more and more patients within your setting.